So, good afternoon, everybody. My name is Martin Smith. I'm Chief Executive of the London Borough of Ealing. But I also lead for my colleague London Borough Chief Executives on the health agenda. And in that capacity, I chair something called the London Health Chief Officers Group, which is an august body of many and varied participants, but is one of the things we've tried to put in place to exercise some whole system leadership in a system where distributed leadership is now the norm. Firstly, thank you all for being here. As you might expect, I'm particularly attuned to the pressures on and demands on my local authority colleagues, who will have a number of different agendas running concurrently, some related to what we're talking about here, some totally unrelated. So I'm really grateful for the support of my fellow CEs, Directors of Adults, Children's and Public Health that I can see scattered amongst the audience. Because of my London-wide role, I often get asked to explain the new health landscape because people expect that I'll understand it. So I valiantly try to do that. I then point them in the direction of the excellent King's Fund animation. But invariably at the end of my description, what comes out, someone says to me, so who's in overall charge then? And of course the answer I give is no one. And then we have a little debate about the merits and dismerits of a system where nobody's in charge. But I've got two observations to make about that. And the first is that I'm not really sure that anyone was ever in charge. I think we thought people were in charge, but actually they were in charge of bits of the system, not the whole system. And if we look at the context and the challenges that Anne set out in her introduction, I think it goes beyond the need to reform health, beyond the need to reform health and social care. We're talking about, particularly given the context of no money, we're going beyond those issues into the relationship between state and public, behavioural change amongst our populations and societal expectation. And I'm not sure anybody was ever in charge of that. And I'm not sure that anybody could ever be in charge of that. So I think it needs, and it's echoing what Howard said, some sort of collaborative model to make it work. And it sounds like nobody was in charge of it in 1892 either, and not much has changed. So I think we fooled ourselves to think that somebody was ever in charge of that agenda. So we're now in this world of distributed leadership. It's challenging. You will all have your scars and battle stories of some of this. The various organisations in this room, which you represent, work with very different accountability regimes, very different financial arrangements, very different expectations in terms of the relationship with your stakeholders, and of course, last but not least, the holy grail of very different organisational cultures. So, given that background, there is incredible scope for us not to be able to structure a coherent agenda. There is also incredible scope for us to fall out with one another, not intentionally, but I think our ability to annoy one another with different language, terminology, and some of those cultural traits knows no bounds, and part of our job is to stop that happening, quite frankly. But I actually believe if we can get the model to work properly, it's extremely powerful, because it can bring together the components that we need to bring together to address the challenges that were set out in the introduction. And I'm personally of the view, but I would say this, wouldn't I, that the most radical change is brought about when we can align political leadership with professional expertise and managerial effectiveness, and that's our challenge. And I can point to lots of examples, some related to this agenda, some completely divorced from this agenda, in my own world of local government, where those three things coming together have achieved change that actually, with hindsight, you wouldn't have thought was possible. So it seems to me our goal is to achieve that level of coherence in relation to the challenges that we're now facing. I'm therefore hopeful and indeed expectant, but again I would say this, wouldn't I, that health and wellbeing boards have a particularly important role to play in this. But I do recognise that they are relatively new parts of the landscape, and they've got a lot of learning to do in order to address the scale of change required at the pace required to deliver a sustainable and safe health and social care system going forward. On a very practical point, I'm also, I think, in favour of the developments that have been occurring around the Integration Transformation Fund, because I don't think that's the answer, but it is a powerful catalyst to start to have the discussions that we need to have to deal with some of the issues that we're talking about. But, and I'm going to echo what Anne and Howard said, the thing that will make the biggest difference, of course, is the leadership that's applied to solving some of these issues. And that's the purpose of this afternoon. That's why I'm here. That's why I undertake the roles that I undertake. I hope that's why you're here too. We're planning to develop this forum, and we're planning to hold this sort of session 3 or 4 times a year, subject to what you say, in terms of the usefulness at the end of this afternoon. Finally, a thank you to Anne and her colleagues at NHS England, brackets London, it's a bit of a mouthful, because it's she and her colleagues that have put this together this afternoon, and I think a thanks to KPMG because they're sponsoring it, so thank you very much.